So as far as burns are concerned, I already discussed about taking precautionary measures. So
Yeah.
burns which are more than size of the palms, burns involving the face and the eyes area or the private part areas are the significant burns. That is one criteria. Second, burns which are superficial and deep burns, that when we see the child, we decide how is the extent of the burns. So if burns are significant, we need to come to the emergency services. We need to clean the area. If they are minor burns, we apply silver sulfadazine to that area to prevent the secondary bacterial infections. Now, see, our skin is a barrier that prevents entry of bacteria in our body. Whenever there are burns, that barrier is gone away. So these babies are at a higher risk of developing infections. If it is a relatively minor burn, superficial burn, we apply topical creams, antibiotic creams, as well as we do give some oral antibiotics also. However, if the burns severity is significant, they do need special dressing in the hospital setting. They need a very close monitoring of loss of water, and then we have to give some extra fluids, IV fluids for certain salts to prevent the dehydration part. And then these burns also need IV antibiotics. You must have seen, many people having deep scar secondary to burns. Now, with advances in the plastic surgeries, there are different, coverings on the burns that can help to minimize the scarring in future. So it is very important that any burns which you feel are significant, as I described, or deep burns, get in touch in time so that we can prevent this long-term complication. And that is what, I started with medical emergencies having immediate effect and long-term effects. So these long-term complications can be also taken care of if you intervene them at the right time.